Thank you all again for joining us for this week's presentation. In recent weeks, we've focused on the layered public health program we have in place at Georgetown and on developments here in the United States regarding vaccines. Today, we'll turn our attention to the global dynamic of the COVID-19 pandemic. What are we seeing around the world? How many cases and where? What is the status of global vaccination efforts? What is the impact of the Delta variant and the emergence of new variants? Let me begin with a review of the global situation, and then we'll be joined by one of our leading global health experts, Professor Lawrence Gostin. Professor Gostin has many roles, engaging with the World Health Organization, with national and local governments here across the United States. And at Georgetown, he leads our O'Neill Institute for National and Global Health Law at our Law Center. Turning first to the cases of COVID globally. The scale of the crisis over the past 20 months has been catastrophic. We have seen 220 million cases of COVID-19 and 4.5 million deaths since the pandemic first emerged. There are still about 650,000 new cases reported every day around the world. 160,000 of these new cases are in the United States. We are currently considered a hotspot. Other places that are currently hotspots for COVID, marked in the deeper shades of red: the UK, Botswana, Iran, Malaysia, and Mongolia, among others. Many other countries are seeing elevated numbers of cases, from France and Norway to Russia and South Africa. Now, turning now to vaccines, we have given significant attention to the vaccination efforts in the United States. Now close to 60% of our population is vaccinated. In the global context, our vaccination rate is among the highest. As you can see, there are significant differences across the world. There have been more than 5 billion vaccine doses administered. 80% of these have been administered to people in high and middle income countries. A new international partnership, COVAX, is working to address this gap. Founded last year, COVAX is an international initiative of the World Health Organization, UNICEF, and others. And they have the goal of providing 2 billion vaccines in low-income countries by the end of this year. 35 countries were able to access their first COVID-19 vaccines through COVAX efforts. This is a vital piece in the global fight against COVID. Many of these cases around the world are being driven by the Delta variant of COVID-19. In July, the Delta variant became the dominant strain of COVID-19 globally. It has been detected in more than 120 countries. It is able to spread in part because it is more transmissible than earlier variants of COVID-19. Communities with low vaccination rates are most at risk of this highly transmissible variant. Vaccines and masking and other public health interventions are, in general, still effective against the Delta variant, especially when used as part of a layered public health approach. But with high levels of COVID-19 cases around the world, there is the continued possibility of new and more dangerous variants emerging. There are 3 categories that the World Health Organization uses to track variants: variants of interest, variants of concern, and variants of high consequence. It created these characterizations in late 2020 in order to coordinate tracking of variants for global monitoring and research efforts. And in May of this year, the WHO announced a new system of naming variants for the general public, following the Greek alphabet, rather than focusing on the scientific name or the first detected place of origin. The WHO is currently tracking 4 variants of concern. This is where Delta fits in, as well as Alpha, the name being used for the first variant of COVID-19. You may also recognize the other 2 variants in this category, formerly referred to as the South African variant, now called the Beta variant, and the variant which originated in Brazil, now called the Gamma variant. These are the most dominant strains, with Delta the most dominant variant worldwide. There are also other strains that the WHO is tracking, what they call variants of interest. These are those variants which we are watching for possible future impacts. They may turn out to have mutations that make them more transmissible or cause more serious disease. The more transmissible they are, the more likely they are to become a dominant strain of COVID and affect more people. 5 variants are currently on this list, with a new variant added on August 30th called the Mu variant. This variant is attracting particular attention from the scientific community, with some indications that it has the possibility of evading our current vaccines. Much more study is needed. There are no variants in the high consequence category. This is the most serious category and would apply to a variant that would significantly challenge prevention measures or medical responses. The more cases of COVID-19 that circulate, the more likely it is that new strains can emerge and then spread. This is what makes our vaccination efforts and layered public health approach so important. Now, I wish to bring in Professor Lawrence Gostin, who can put all of this into perspective for us.
Larry, thank you again for joining us. We're so grateful to you and for your expertise in our community and for your contributions in leading our O'Neill Institute for National and Global Health Law. You and your colleagues are doing such terrific work in helping us all to understand the most important elements of a global pandemic response. And I'm always grateful for this time that you spend with us to share your perspectives. So let's start with vaccines. We've seen 5 billion vaccine doses administered worldwide, 1 billion vaccine doses in just the past month. Despite these large numbers, we know that there is much more that needs to be done. How would you describe the global vaccine effort to date?
Well, first of all, President DeGioia, thank you very much for having me on and for also, all you've done to lead Georgetown back this fall. It's really great to be back on the hilltop and at the Law Center. Most of my colleagues, and me included, are very worried about global vaccinations. Yes, you're absolutely right. We've seen a literally historic vaccine campaign, but most of the vaccines have been in high-income countries, the United States, the UK, the European Union, and other high-income countries, and only a fraction have taken place in low and middle-income countries. And that's certainly a problem for equity and for our global compassion for our fellow humankind. But it's also a matter of United States national security, because no matter how good we do in curbing SARS-CoV-2, and we're having quite a problem right at the moment with the Delta variant, we're still going to see additional variants of concern arising so long as the virus is circulating so rapidly around the world. And we have to remember that this new mutation of the virus is extraordinarily infectious. CDC said it was as infectious as chickenpox. They weren't quite right about that. It's not quite as infectious, but I think all of us understand just how contagious this virus is, and it's running out of control in places like sub-Saharan Africa and Latin America, and even in middle and upper middle and higher income countries right now. And so we absolutely need to vaccinate the world, as Dr. Tedros has said, and I've talked to him about this many times. He's the head of the World Health Organization. No one is safe unless everyone is safe. And right now, even health workers in low-income countries haven't been vaccinated, and they're out there every day providing treatment and care for people who are gravely ill with COVID-19. So we need to do much, much more.
Now, earlier I described the categories that the WHO uses to track variants as they are identified around the world. And the worry, of course, is the emergence of variants that may evade our current vaccines. You and one of your colleagues at the O'Neill Institute, Eric Friedman, wrote an article together for Foreign Policy a week or so ago. It was entitled, "The Whole World Needs Vaccines Before a Worse Variant Than Delta Arrives." Could you walk us through some of the steps that our national and global institutions need to take to prevent and respond to the spread of new variants?
Yeah, it's a really important question, and maybe the most important. It was only a couple of days ago, maybe just a day or two, that the World Health Organization announced a new variant, which they're calling Mu. And early reports is that it has the capacity to evade vaccine-induced immunity. And that it needs far more study, and it may not turn out that way, but the worst scenario, the nightmare scenario, Jack, is as if we had a variant that actually was able to overcome the immunity of either a person who's recovered from COVID-19, or more importantly, somebody who's been fully vaccinated, particularly with messenger RNA vaccines. And so as we all know, particularly those who've worked in infectious diseases and pandemic preparedness, that, under Darwinian evolutionary principles, all viruses mutate. And the reason that they mutate is to try to become fitter, a better virus. It's not better for us, but it's better for the virus, because it can be more contagious, can be more pathogenic, it can evade immune responses, or it could be completely benign. And most mutations are entirely benign, so we don't want to panic here. But so long as the virus is able to freely circulate, and this one is circulating globally in the millions and millions of people, then we're going to get more mutations, and the virus will find a way to outsmart human ingenuity. And that's why we need to stay a step ahead. The only way we can do that is to vaccinate the world, and do it as quickly as we can. And I didn't answer your question about how we do that, but I can do that now if you want.
But that'd be great if you just give us a sense of
Yeah.
what makes.
Yeah, I mean, we at the O'Neill Institute and others around the world have suggested a number of ways that they can do this, and including what I'd like to see happen is for President Biden to lead this effort. And I think he has a golden opportunity to do that leadership, because we're now probably going to roll out so-called boosters or third doses of mRNA vaccine in the United States, which many people have worried about from an equity point of view. I think it would be all right to do that for our vulnerable population, so long as we created mechanisms for vaccinating the world. So what are the mechanisms? One of them is simply to significantly ramp up supply, so that supply can begin to at least meet much of the demand globally, which will be phenomenally high. The second way, and this is related, is for us to donate those vaccines and to lead our partners in the G7 and the G20 to do that. We're likely to see an effort by the president to do just that at the UN General Assembly meeting this September. And I hope he goes big and bold, the way the only America can, as we did with PEPFAR and supporting the Global Fund in the fight against AIDS, tuberculosis, and malaria. US was always in the lead there. The second thing we can do is waive intellectual property rights. President Biden has already supported that, but he's getting pushback from the European Union. The third, and this is the most important, is technology transfer. That is, share equitably the know-how for making vaccines so that we can have regional hubs for the manufacture of vaccines. We can donate a vaccine, and that will save a life. But if we donate the know-how to make the vaccine yourself, you save a country and you save a region or the world. And there are a lot of good places around the world that know how to do this. Singapore, Indonesia, India, South Africa have the wherewithal to be able to do that, but they need us to share the technology and the know-how for them to do it. So there are lots of ways, ranging from donations, ramping up domestic supply, through to intellectual property waivers and sharing scientific knowledge. Those are the sure ways to get this done.
And Larry, you've shared with me, and perhaps this would be a good moment to share with all of our colleagues who are watching. You are now involved in putting together a very significant convening that would be part of a global response to this pandemic. Could you share a little bit of the details of the convening that you're currently providing the leadership for?
No, I'd be happy to, and I'm really bursting with pride at Georgetown University and the O'Neill Institute for doing this. And it's everything that you and our donors like Tim and Linda O'Neill, Bill Traynor, the Dean of the Law Center, had ever hoped for in terms of the impact. Earlier this year, 50 heads of state, including the entire European Union, the UK, most of our allies and partners, along with the World Health Organization and the United Nations itself, called on the world to develop a pandemic treaty that is a binding international instrument that would help us prepare and respond to future global health crises. And there will be many, as we all know. And so in an historic move, the World Health Assembly is meeting this November for the first time ever in a special session devoted to a single issue, which is a development of the pandemic treaty. And the lead up to that will be discussions at the UN General Assembly in September and in the G20 group of nations in October. And Dr. Tedros of WHO said that these 3 months, September, October, and November, will be the defining moments for a future response to the crisis. And I'm very proud that Georgetown University and the O'Neill Institute is partnering with the National Institutes of Health um, to support the World Health Organization and heads of state in helping to define the processes and content of that treaty. We're bringing together an international consultation of the most foremost experts. Will be welcomed by Dr. Tedros himself in Washington at Georgetown in just a couple of weeks. It includes the head of the African CDC and all of the major regions of the world, and that will be followed by regional consultations, all in support of the next phase of how we prevent this kind of a disaster from happening again. So this is really important work, but it's hard work. But we've got the best minds in the world joining us at Georgetown University to help solve this problem.
Congratulations, Larry. What a tribute to your exceptional leadership over the course of so many years. It's an honor to be able to learn about this in this moment with you.
Yeah, as I said earlier, Jack, it's not me. We have just an incredible team of partners at WHO, NIH, and the university itself. So this is really truly a team effort.
Let's return to some of what is unfolding globally, and I'd like to talk a little bit about the Delta variant in more detail.
Yeah.
In India and then in the UK, we saw steep surges and then sharp declines in cases.
Yeah.
The UK is now seeing another rise.
Yeah.
Are there lessons that we can bring here to the United States in understanding the trajectory of the Delta variant and what we might expect in the coming months?
Absolutely. Let me preface this as any good public health person should. That we have to be humble in the face of this virus. I've called this a wily virus, or almost the perfect Darwinian virus, and the Delta variant is extraordinarily dangerous. But what we've seen with the Delta variant, but we've actually seen it throughout our history with this virus, is that SARS-CoV-2, for some reason, seems to surge and then wane and then comes resurgent again. We've seen that over and over again. And what we've now witnessed, not just in the UK, Israel, the European Union, and many other places, is that experienced Delta before the United States, is that the surge period appears to be around 2 months or so. And then tends to go down. And that's not always true. Some get it earlier, can defeat it earlier, some later. But that's been the experience. Many of us foresee that will unfold over the next month. And so I think, for example, for Georgetown University's return and for the nation, the next month will be a perilous one and a difficult one. Then I do expect to see the virus to subside, and perhaps considerably in the United States and in other countries that have experienced this surge. Now, the question is will it have the same ability to remake itself and resurge again? I'm hoping that our vaccination rates are going to be so high that we'll be able to, if not prevent that, to really dampen it down. Tony Fauci, who, as you know, has been a very, very good friend of mine since the AIDS epidemic, and a great friend of Georgetown University, told me and others that he expects that by the spring we'll have really good control over the virus. I think Tony is right, and I hope he's right. But we just don't know whether there'll be new variants. But the key is whether or not all of the vaccine mandates that we're seeing at universities. And I love the fact that Georgetown's doing this. We have such a high vaccination coverage. Universities are doing it. Businesses are doing it. The federal government has done it for its workers, the military, the National Guard. State governments are doing it. There are vaccine passports that like the key to New York City. And so I'm hopeful that we're going to pass a point where we won't get to herd immunity, I don't think. But I think we're going to get to a point where there isn't a lot of room for the virus to spread. But for that, we need two things. We need high vaccination coverage. And secondly, we need to kind of stem worrying variants that could emerge from around the world and reseed themselves here in the United States.
Larry, I can't begin to express my appreciation to you for taking this time to be with us and to share your perspectives, and continued best wishes with all the great work that you are leading for us here at Georgetown.
Well, thank you very much, Jack. I appreciate it so much. And I love to be a member of your community.
Larry, I cannot thank you enough. It's always a privilege to engage with you and to hear your insights about the global challenges we are facing with this pandemic. Thank you again for taking the time to be with us today. And I look forward to being with all of you again next week for more updates on our work here at Georgetown. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.